Chair recognizes Representative Heinz.
Thank you, Mr. Chair, members. I also rise in support of the Farley Amendment on the floor. As a medical professional myself, I'm very concerned that, first of all, that we're discussing this at all. But as the bill was written at this time, it appears to actually redefine some accepted medical terminology, which I believe is something we should try to avoid as a legislature. What I'm referring to in particular, which I'll begin with, is a viable clinically diagnosable pregnancy. Now, I understand that the bill defines this as the union of a sperm and ovum. However, fertilization, as I hope everyone knows, occurs at the ends of the fallopian tubes, which are attached to the uterus. Forgive me for not bringing my uterus model. And that's not where a pregnancy occurs or could be even defined necessarily as a viable intrauterine pregnancy. That is where the ovum conceptus, which has been fertilized, travels through the fallopian tubes, takes 7 to 12 days, and then there's implantation in the endometrium, the wall of the lining of the uterus, and then blood vessels supply the developing embryo in that situation. That is what a pregnancy is, a clinically diagnosable, viable pregnancy. So I'm a little bit unclear as to what we're trying to do with that language. Next, I'm very concerned about how this bill is going to affect the provision of health care, especially to women. I appreciate the comments of Representative Fleming and also Martha Garcia. Pharmacists being allowed to refuse any sort of medication ordered by a licensed physician is very disturbing to me, especially in regards to emergency contraception, where there's not exactly a lot of time available for the patient to go to another place. There's also no requirement that I see in the bill that says that the pharmacist who is refusing for moral reasons or for conscience has to refer the woman to somewhere where they can obtain this urgently needed medical attention or device or prescription. So I don't like that at all. And then I do believe this is beyond the pharmacist's scope of practice, because there, again, in this bill, the way things are defined, even with the Bartow Amendment, it is unclear to me if this could possibly prohibit certain other types of hormonal therapy, which may not be used for birth control at all, to control excessive uterine or vaginal bleeding. A pharmacist should not be authorized to refuse these medications when prescribed by an appropriate licensed physician. And then regarding provider refusal, which this amendment takes care of, there's already many laws on the books that allow for providers to refuse to participate in any type of abortive procedure. That's fine. However, and then moving on to the script that Mr. Farley is discussing that his amendment removes, this script is very disturbing to me because, again, it does interject government, us, in between my patient and me. Unacceptable. And you wouldn't want that to happen with you or your provider either. It's a very bad precedent to set. And also, I believe that the script as written forces physicians to provide, or providers to provide, information that is not necessarily factually accurate. It talks about child support and public services that could be supportive for a woman who chooses to proceed with a pregnancy when, as we all know, in the midst of this budget crisis, look at DES. All these services, many of these services have been greatly and adversely impacted. And I just wonder if that's appropriate for us to force a physician or provider to tell a woman she would have help when indeed she would not. I don't like that. And then I think lastly here, regarding the 24-hour waiting period and the requirement of 2 visitations to this health center or these health providers prior to undergoing the procedure, again, informed consent is something that has to happen for any medical or surgical procedure as it is. All those laws are already on the book, so this is redundant and unnecessary. But more than that, it actually places an increased and undue burden or unfunded mandate upon these health centers. And I would like to stress that these health centers, 95% or more of the resources of these health centers actually go to many other needs that serve the public good and contribute to maintaining and improving the public health. First of all, well woman visits. Many women only get their primary care at these types of health centers.
And there's only 30 seconds left, please.
Thank you. I only have 30 seconds more to speak. Also, sexually transmitted infection screening and treatment for men and women, very important public health benefit. Family planning, counseling services, and procedures other than abortive procedures are performed at these facilities. For example, as Mr. Farley mentioned, vasectomies in males. So I would say that the healthcare system cannot afford
Thank you, Representative Heinz. Your
further
time has
unfunded
expired.
mandates, and I thank you.
Thank you, Mr. Heinz.